everyone, Michelle Seidling here with another episode of Food Experience Unplugged. Today we're talking about health insurance. And typically, health insurance has a bad name. But in this case, we're talking about wellness and what the health insurance industry is doing to help you be well and things that you can do to work with them and to be more proactive in terms of your health and wellness. Here to help us do that is Tom Basey, an insurance guru of all sorts. Welcome to the podcast, Tom. This podcast is available on multiple platforms, including YouTube, Apple Podcasts, Spotify, and others. Please be sure to subscribe on your favorite podcast platform to be informed as new episodes become available. If you enjoyed today's episode or any of our episodes, please rate and review the podcast on your favorite platform. As always, check out our website at foodexperienceunplugged.com for some resources as you begin your health journey.
Good. Nice to see you, Michelle. Thanks so much. And I love what you said there because that sounds good. To your point, all insurance is often not a fun topic, but I'm thinking we can try to make this at least fun and interesting. So thank you very much for having me on today.
Oh, you're welcome. To get started, will you tell us a little bit, introduce yourself and what brought you to the insurance industry among all your other career choices?
I will, and I think I'll issue a caveat. I worked for 30 years in corporate America, and I always got health insurance through the carrier. So one, I didn't know how to get insurance otherwise. I also, candidly, I've been a lifelong pursuer of wellness. So I've always tried to eat well, and I've always tried to live well. So this discussion is right in my wheelhouse. So I've worked in corporate America as an engineer and a project manager for 30 years, but I'm 4 years in now as an independent insurance broker. And really how I got there, I wanted a second career. I wanted to leave corporate America, and I wanted to kind of be able to set my own working hours. And then actually I was a customer first. Somebody reached out to me while I was still in corporate America, and I enrolled in a cancer specific policy for me, my wife, and it covers my son until he turns 26 soon. And so it's one of those things, kind of like the hair club president thing. In other words, I was actually a customer first before I got in. And so I didn't understand health insurance. I didn't know how to get it. And then I understood the value because cancer is something that does occur frequently and it can have a real negative financial impact. So I was a customer initially. Fast forward 4 years now. And so I'm appointed with a bunch of different carriers. I'm a broker, so I'm an independent agent, but I'm appointed with a lot of different major carriers. And for example, this says Basey Insurance. I don't protect someone's home and their auto. Not property and casualty. I just do health insurance solutions. And so I'm appointed with a lot of different carriers. I focus predominantly on Medicare, but I can also provide some individual health insurance solutions. And even for small business, I have some options as well. But sometimes it's easy to talk about Medicare. But bottom line is I'm an independent guy and I offer these healthcare solutions from a bunch of different carriers to somebody and help them tailor the solutions, what I call it, find one that works for them in terms of pricing, coverage, benefits.
Okay. So it started more of on a personal level with you, enrolling in a given insurance. So what sparked you to actually decide to work in the insurance industry?
Okay, great point. So as I remarked, I wanted to have a second career. I was actually I have a master's degree, but there's a local university here. I'm based in Texas, but I'm appointed in multiple states across the U.S. But there's a local university that if you have an undergraduate degree, you could take a lot of classes online and get certified to teach. And I'm telling you, there's two things. If you recall, I was already a customer. And number two, it's really education. So really what I do, my title is an insurance broker, but really I educate people. And so in a certain way, I'm still scratching my education bone, just kind of helping people understand, because I did not understand. I didn't understand what co-insurance, that word, I didn't know what that meant. And so I help people understand premium, deductible, copay, co-insurance, help them understand that. And then actually the good news is, and I think this is what we're going to talk a little bit more about, insurance is becoming more and more full featured. And so they help you take care of their solutions, their life solutions. So I help people understand and explain that to them. So that's kind of, I hope I did an adequate job of describing it because it's a great question. It wasn't straightforward, but so that's how I'm here.
Wow. Okay. That's good. That's just seeing that opportunity and wanting to help people. And then what you're seeing in the health insurance industry is that turn more to wellness rather than waiting till you're sick to handle any claims or so forth. But I guess when we think of the health insurance industry, we still have that negative flavor about it, so to speak. Why do they have such a bad reputation or a previous reputation with regard to health and wellness?
Okay, so I'll try to answer that adequately. What I would offer is this: number one, traditional. When someone says health insurance, often they're typically talking about major medical insurance. And I'm a proponent of major medical insurance. I have major medical insurance. It's not perfect. It is at both the best one and the worst one, I might say, because my point is it covers the most things, if you will, but it is expensive and yet it doesn't cover it. And so I would contend that's why there's this bad reputation. So my point is most people get major medical. Like I said, I have a major medical policy. They get it through their employer. And what happens is it tends to be expensive. That's because healthcare is expensive. Drugs are expensive, healthcare is expensive. But bottom line is, so your monthly premium that you're paying is expensive. And then doggone it, typically there is a deductible. That deductible is what someone has to pay before the insurance kicks in. And that continues to get bigger and bigger. And so it doesn't sit well with anybody where I'm paying this significant monthly premium. Doggone, I have to pay X $1,000 before it even kicks in. And then we get into that co-insurance and or copay. For example, the easiest number to use is 80/20. That is, a lot of people have it such that once they've met the deductible, the insurer will pay for 80% of it. They still pay that 20%. And that 20% can be significant too. Now, sometimes there's an out-of-pocket maximum, which is good. Hopefully that's the case. But my point is, my message is that's why it doesn't, people don't have a great positive thought of it because it costs them a lot per month. And then doggone, even though they do pay, there's still some significant costs afterwards. So I can understand how that wouldn't play well with people. And so that's my example of why it doesn't feel good. The good news is, as I mentioned, there are ways.
I guess a current
Mhm.
state of the union, I guess, on
I can
the
remark to that,
wellness
sure.
aspect of it.
Now, what I would offer is just like everything, not all policies are the same. So this varies. And these things, I'll make some generic remark. Like I say, I'm appointed in 10 different states. It's not necessarily true in every state and or not every. How about this? In the extreme, I'll say this. Here's an example. When you see a commercial on TV, because I think these are national ads, you'll see commercials about Medicare, and they'll go through a long list of benefits that are in there. Okay, and so some of them are purely financial, like there's a Part B give back that is kind of a rebate, if you will, on potentially a low premium anyway. But there are things like it'll say $0 copay for preventative care. That's one example of what you're talking about there. That is that you won't get charged because insurance companies have recognized clients that they protect are more cost effective to them if they're healthy. So they do want you to be healthy. So typically they will not charge you for preventative exams. So that's one thing they do. And they'll go through and they'll list other things. It'll say things like transportation. Sometimes transportation is provided for the same reason. Now they will not take you to the mall, but they'll give you say 12 or 24 one-way trips to medical things. Again, so to me, that's ways they're incentivizing someone to address their health rather than sitting at home and worry about it. So then another thing they will say, they'll talk about sometimes the personal emergency response system. They will provide sometimes at no cost one of those things. So if you fall, you can press a button and get into it. Sometimes those are available. So my message is these companies, and we can talk more about them as you wish. They offer a variety of different solutions because you are incentivized to be healthy. I think the one you and I have talked about a little before is some of them provide a healthy foods card. So sometimes they will give you X dollars per month or per quarter. And sometimes, depending on your economic circumstance, it can be significant. But they will give you X dollars. Again, you cannot buy cigarettes and beer on it, but you can buy health cards. It's like a prepaid debit card. So to me, that's yet another example of how they're wanting you to be healthy. So you are incentivizing. So yes, they're going to charge you potentially per month, but they are incentivized economically because they've done the studies. They know insurance companies know how long people are going to live statistically, right, and that kind of thing. They know what diseases cause are expensive, so they want you to be healthy. If you want to say it selfishly, okay, but to me, I like the fact that they will provide these solutions for you to try to keep you healthy.
Okay. Wow. So there's just a lot more flexibility in terms of the wellness aspect of it. Sounds
It can
like.
be, and like I said, I want to issue the caveat depending on the policy. So I would venture to say, without knowing anything different, anybody listening to this podcast, the most people in the U.S. get their insurance from their employer. So the things I've talked about aren't necessarily available from your employer, but it's good to check in. Often they have one. Here's another one. Sometimes often these days they will provide some kind of wellness package. What that can be either you can go to a gym at zero cost or reduced cost, or you can even access virtual information, guidance on healthy eating, or virtual workout. So my message is really see what insurance you have. Unfortunately, people don't even know because it's not fun, right? Often you pick it at the beginning of the year. You don't even know if you picked the HMO or the PPO or the high deductible. Yeah, you just picked one and then you're done with it. And every year it changes. Well, I would encourage them to take a look at it. Go get your policy, see what you have, know what your deductible is, but then also see if there's some benefits in there. See if they talk. Sometimes there'll be a dental benefit you didn't realize you had, or like I said, maybe you'll have something. Maybe you'll have some kind of wellness program, and sometimes even incentives. Many people have it such that if they will do these things, for example, if they'll get a cancer screening or their blood work done to check their a variety of vital markers, that you can actually save money on your health insurance. That's another way to do it.
Okay. Do you have some examples of how the insurance companies are incentivizing or promoting wellness to people?
Well, so I will talk a little bit further. Again, I don't want to get too specific in that it's can vary plan to plan and carrier to carrier. So let me say that. So number one, I'm appointed with a lot of different carriers. And the good
Sure.
news is, and I'm appointed really largely with major carriers. I typically don't do the smaller carriers, and that's because I do like their full featured solutions. And so my point is not every carrier does every one of these things, but typically they do several. So I like them. And so for one thing, they found a correlation between heart health and your dental health. And so really they will often you can go to a dentist for an annual or semi-annual exam. Often it will cost you nothing or a small thing because they recognize they want to check that because there's like I say, there's correlation. Like I'm not a doctor, I don't even play one on TV, but my understanding is that they've determined this. And so they would often you can go through one way or another, you can go and get an oral exam, teeth cleaned, often at zero cost or very little cost, and they're also checking your heart health as a result. Similarly, you can often they will either at a low cost or a zero cost. You can go and get your blood work done, and they've got these correlations now. And so, like I got it done during COVID times. I understand things got shut down a lot. Certain services weren't available. You were concerned about going, but I finally went in within the past few months and got my blood work done. They can learn all kinds of things about a human, their diet and that kind of thing. Be it the cholesterol level. You can check for various cancers. A lot of different ways they can do that, right? And so often they're incentivizing you because they won't charge. That's why I'm a big proponent of checking and making sure you've got that available. But if it's available, goodness, I think someone should take advantage of that. I'll remark a couple more. So, like I say, I will. I'm trying to be brand agnostic. So I don't want to say I'm measuring my words. Certain carriers will even offer either a zero cost or a discounted gym membership fee or wellness program. And when either one of those, that's not just exercise. That can also be a resource. There's information provided, for example, on a healthy smoothie recipe or recommended stretching techniques. And let's see, diet and exercise. And then, yeah, sometimes there's even led either in person or virtual. They'll lead a yoga class or a Pilates or so. So I claim there is a spectrum of solutions at these carriers. And I love the question, right? Because we're trying to dispel the negative thing. So we started out, it is the negative perception is not without merit because you do have to pay X $100 a month perhaps to get this thing in there. But the good news is there's some really good things above and beyond just the financial thing. So hopefully we've talked about those some.
Absolutely, absolutely. Now I think you alluded to a little bit with your personal situation, but how are you personally using, whatever insurance you have to, as far as the wellness aspect?
Okay. Uh, Now let me think about that. For me personally, I don't know that I'm using all the wellness things. I have thorough insurance solutions that I use, but candidly, they're more peace of mind than anything else, or at least that's what comes top of mind. So my point is, I have a traditional health insurance plan, which I'm fine and glad to have that way, because if I go to the hospital stays are very expensive. I will be covered. Now, the challenge for me, just like everybody else, is I have a significant X thousand-dollar deductible, and then there's a copay. I don't know if it's 20%. So what I've done then is I've added on some supplemental policies. So and again, this depends on your zip code and your age, but for less than $30 a month, people can get these supplemental policies that will help what I call the deductible monster. So for example, let me throw some stats here because these are helpful sometimes. The average medical event in the US prior to COVID, because things get challenging to quantify the last couple of years, was $6,000. That was the average medical event. And so my point is, if you had a $6,000 deductible, well, then on average, your insurance almost isn't going to do anything. I'm expecting you to have a $6,000 accident or some kind of event, and you're going to have to pay that because the deductible is that. If you have a lower deductible plan, your deductible is only $2,000. Well, then statistically, I'm expecting you to have to pay $2,000 deductible and then whatever else, maybe 20% of the $4 there. But my point is, you can get these supplemental policies. So you can buy an accident policy, or you can buy a critical illness policy, which is a heart attack or stroke. Some of these things that are expensive and might just occur like that. You can buy cost-effective solutions for those, so that if you have one of those events, they will help. They basically fight off the deductible ones. They'll cover it, for example. And then the other thing, you hear this on TV all the time. When these medical events happen, sometimes you're out of work, and so you can't pay. You're not working, so you still need to pay the light bill. And so my message is not necessarily wellness, but for me personally, that's kind of how I got into. I bought myself this cancer policy. Cancer is an expensive disease, and so although I'm not necessarily using the policy directly to do that, I have it to protect myself. To my dismay, actually, let me give you the good news first. The good news is the two most prevalent versions of cancer in the U.S. are breast for ladies and prostate for men. But the good news is we're at a 97% survival rate. So medically, we're making advances towards cancer to prevent that, or rather to treat it. But the bad news is it's 1 out of every 3. So somebody's going to get those things. Now,
Mm.
now the average cost of those is about $20,000. So that's the thing. Unfortunately, it's likely you're going to get it. The good news is you're going to survive. The bad news is going to cost you about $20,000. So hopefully, so you might consider a supplemental policy to take care of that. Now, having said that, for me personally, I try to eat well and I try to exercise. That's the thing. I'm not going to come on here and try to be an expert. And I'm listening. I'm looking, because there are people who try to tell us and provide guidance. So I try to eat healthy. So I've been long told to avoid red meat. So I avoid red meat. I try to eat as much vegetables as I can. I try to avoid carbs. I have smoothies in the morning, and then I add ingredients like turmeric and cinnamon to my fruits. And I use a non-dairy. I use alcohol. So I try to eat healthy, and then I go to the gym. Fortunately, because of insurance, I've gotten to where I can go frequently. Again, when COVID occurred, okay, gym shut down, but I go to the gym or I play soccer almost every day. So I'm trying to live healthy and I'm trying to eat healthy. But when it comes to insurance policy, I guess to answer your real question, they pay us to do I get compensated. In fact, some of those policies even reimburse you. If I go and get a screening on cancer screening, then I get a reimbursement. So I do that. I go and get screened for cancer, and I go and I get my blood work done, because so I'm incentivized. So that's a roundabout way to answer your question, but that's how I'm using those policies.
Okay, fantastic. I love that. Just as you're working, it kind of motivates you almost to be proactive about your health, because
hmm
you in addition, to having insurance, you're also doing those things each day to promote your health and to do what you
Well,
can.
what I would offer, that's what it's all about at the end of the day. In other words, on the contrary, if we're not healthy, actually statistically we're lasting longer too, right? But I don't really want to last longer if I'm suffering. So I want to, so really my motivation is to feel good today. I want to be able to jump up out of bed every day, basically. And so my personal motivation is not necessarily even how long I want to last. But I want to be healthy. I really want to just not suffer. A lot of folks suffer in one form or another, just the way their body physically feels for whatever reason. I'm fortunate that that's not the case for me yet, but I'm worried. That's my motivation, is I want to just feel good. I don't want to suffer in life. I want to enjoy life, enjoy the people around me through good health. That's my motivation.
I love that. Just as far, just you yourself are being motivated, and then you're also kind of paying it forward a little bit in helping those clients with whom you work, and others, to kind of spread the word, so to speak, about the wellness aspect of it.
hmm
So powerful. Wow. So tell us about what is, now you yourself are motivated to do different things health wise, but what are some things that people can do to really maximize the wellness aspect of it, with regard to their insurance, with regard to other things that they may be motivated to do?
hmm well, the first thing I would offer is get educated on what you currently have. And so, like I say, each plan is different. Personally, for example, I mentioned I do Medicare as well. So actually, twice a week, I sit in a local grocery store and I man a kiosk for one of the major carriers, just answering questions or providing information. Like I've got their brochures and that stuff. And then what I do is, of course, you might imagine some people I talk to don't have that solution. Some people do. Even if they have the solution, like when someone say, "I've got that company already," they like to say that, right? Because they think I'm trying to sell them something that, I've already with that company. I say, "That's great. Let me remind you that one." I'll say, "Which plan do you have?" And they'll say, "I have this Advantage HM1." I say, "Let me remind you, quarterly they provide an over-the-counter benefit." With that over-the-counter benefit, because they have you sitting this at the pharmacy. Most people are coming in to pick up some prescription. But I'm saying that over-the-counter benefit has nothing to do with your pharmacy. You can order online from the catalog. You can get aspirin, anti-digestive things, band-aids, anything you might buy at a local pharmacy that's kind of personal care related, health related. They give them a quarterly credit, and so I'll remind them to do this, even though they're already enrolled. So saying I'm building goodwill for that company when I'm sitting there and doing it. But my point is, find out what your current situation is. Check and see what benefits they have. They may have a membership for an online wellness league. Sometimes they even have advocates where you can call and ask a question. Some corporate health insurance thing, they call them different fancy names, but really what they are is it's a hotline where you can call and you can either ask a question about diet. Sometimes they'll even make a diet plan for you. Not everybody has it, right? But that is available. Or it's a health concierge. Sometimes just check in and make sure, depending on what you have, they will help you, for example, find whatever it's like. What if you like, here's another thing: chiropractic versus spine surgery. Insurances, in a certain way, or at least some insurances, some philosophies of thought, like you to try to maintain or get the back well rather than let it get bad and then require surgery. And so sometimes there's an area where they're going to either at a reduced cost or at a zero cost let you go and see a chiropractor. So I'm just saying, whatever scenario you're in, take a look at it. And I'm telling you, like, guilty. I've done this. Most people don't know what they have, right? They may be able to tell you the name of the carrier that provides it to them, but go ahead and get that thing and look at the card. And there's a 1-800 customer service line, and there might even be, sometimes they'll have a list of the other things they provide. So message one is find out what you have. And then I've got nothing. I've determined all I've got is I've got this plan that I pay the premium, they co-pays, and that's it. Oh, so it's a bare bones housing. Okay, well then maybe you should consider something else. And so you think about this. Maybe you should consider a supplemental policy. For example, if cancer runs in the family. Now, that's the thing I used to say that all the time. If the new stats are telling me 1 out of 3 people are getting it in the U.S., seems like it runs in everybody's family. Apparently, I don't know. But bottom line is, maybe if you're concerned, whatever things, insurance should help you sleep better at night, not keep you up at night. But so my point is, if you're concerned about cancer, or if nobody in my family ever gets cancer, well, but they all die of heart attack. Well, maybe you should consider a critical illness policy. Consider getting a supplemental policy that covers that event specifically. Typically, it doesn't cost much, and typically there will be either at a zero cost or sometimes even incentivized. Like I'm telling you, the policy I'm on, I get paid $40 or $60 a year if I will go and get a screening for it, get the checkup. So supplement whatever you don't already have. So 1, check what do you first have. 2, supplement it if you consider the prospect of supplementing, and then 3, actually just get educated. I personally, I hate to beat this horse, right? But COVID forced us to learn differently, that kind of stuff. Well, get online and search and investigate whatever you're worried about, whatever ails you, whatever's historically family, or whatever maybe you have exposure to, right? And what if your job is such an accident, if you're worried about accidents, or if you're in a hazardous job situation, whatever it is, investigate whatever you got going on and find out about it. Consider getting an insurance thing that will take care of that. I think I'm going to say one other thing just because it's obtusely related, but because it came to mind to me. The last insurance policy I secured for myself was a long-term care policy. So, and if you're worried about something, actually, this stat says 70% of folks in the U.S. are going to need long-term care. Mm-hmm. So I've got these presentations. At the end of the day, it just says we just age, and eventually, no matter how good we eat, no matter how much exercise, our bodies tend to wear down over time. And so, if 70% of us are going to need long-term care, and what that means you can't do 2 of the 6 ADLs, activities of daily living. And it's typically, statistically, you're not going to be able to do 2 of these things: eating, bathing, grooming, toileting, maintaining continence, or transfer, getting from bed. So eventually that happens to folks. Now, statistically, men these days right now, it lasts 2.2 years. For ladies, long-term care lasts 3.8 years. And like I'm saying, these carriers, they've got the information. At least that number may not apply to you or me, but we understand stats. It's an example. It's what most people do, or an expected value. But my point is, you're going to need those. So actually, I'm a proponent of even getting that one. If I look at the stats, that may be the one. And or actually, I guess you get life ones, because actually, 100% of people will need a life insurance policy after this. So my point is, just get whatever you're worried about, investigate, find out, and see if you can get a policy that helps you protect that. And these days, even life insurance, that's the most classic one. Those things are getting more and more full featured. They're not just straightforward. You can still get a 30-year life insurance term, but these days you can get one with living benefits, they call it, which means you don't have to die to get that. You can actually, if you get the cancer diagnosis, you can actually access some of that in advance. And so the story is, in theory, if that's the case, if you get the diagnosis from the doctor that says, to my dismay, you've been diagnosed with colon cancer and we're projecting 24 months max for you, you could actually take that to the carrier, potentially get some or all of that policy back. And then if nothing else, you can do like that song and go all over the world and, experience it. I kind of like that. But my point is, even life insurance, as long as that's been around and as boring as some people think it is, they're adding features to those to help you. I think that's a good example.
I love that. Just, being proactive, just checking those things is super powerful. Are there any particular resources that, as people, try to find out about just different health aspects and the wellness aspect of insurance, things that they can do? Are there any particular resources come to mind?
Well, the first thing that comes to mind is you can look up, for one thing, each state. Here's another thing. When I was a kid, I didn't like it. Not only did I understand I was an adult, as a kid, I didn't like it. Just because when you're a kid and you're recognized, you're trying to get this car insurance is expensive, right? And what I perceived is, what I didn't like is I having to pay X dollars a month on this car for 4 years, and if I never have an accident, I don't even use it. So it felt like it was money being thrown away, right? I didn't understand the significance. Yeah, but the thing is, if in 3 months, 6 months, if you crash that car, they will replace the entire value, right? So there is some merit to it. But I guess my point is, each state, there's an organization, the Department of Insurance, that regulates your insurance. So they're really trying to make certain. And I'm of the opinion, and I only live in one state, so I'd be speaking out of turn, but I think that they, as a general, they do a good job of monitoring, controlling how much premiums, how much they charge you, how much they will allow an insurer or a carrier to increase premiums. And if you think about it, we've seen some of these natural disasters recently. That's part of the reason they get away with you charging much, because they pony up. I mean, you haven't heard about these big insurance companies going bankrupt. They're collecting enough premiums so that they can handle those natural disasters and that kind of thing. I personally, we've had this big health thing, so many hospital stays and go, but I haven't heard any insurers been going bankrupt yet, at least not the big ones. And so I think that's why. So I tend to be a cheapskate. So I like to pay less, but my point is I'm willing to do that for those insurers. And I kind of got off topic there. Bottom. Let's see. Well, forgive me. What question was I supposed to answer for you? I got on my soapbox.
As far as, or if there are any resources in
Oh, yeah,
particular that would be helpful.
There you go. So my point is, you can go to your state. You can. It's typically the statename.gov, and you can go into you can go to the insurance department there, and you can find an agent, for example. Now there's different data, but you can go online and find stuff. At the end of the day, my real message is find an agent that you have a decent rapport with, and that you can trust, and investigate for them. And in fact, I would offer this: find 3. I'm a prone to shopping anything anyway. So just reach out, find 3 different agents near you, maybe not near you, but that you feel comfortable with, and talk to them and get a feel for them. Because, just like anything, how about, you could ask that, someone could say that thing about medicine too. I just think I struggle to give you a good resource at my point. In other words, even whether it's health, because there's so many things that are available, and yet the quality of those can be suspect. There's a spectrum of the quality of that. And so when it comes, same thing with a doctor. I think you can try to self-care, but I'm still a proponent of getting a doctor. There are licensed professional. I made the remark this weekend. I got lucky. I ran into a childhood friend of mine because I moved 3 hours away from my hometown, but he's my doctor. My point is I have confidence in him. I trust that guy. I've known him since he was pre-kindergarten, so my point is, so whether it's insurance or doctors, I struggle to give you a conclusive one, but rather than those agencies, check those and find a reputable person. Both insurance agents and doctors are licensed. That's in life. Insurance folks, they're licensed and they're controlled, and they have to have a sparkling record, and they can't misbehave themselves. And we have to have to get recertified all the time. Every couple of years, you have to get re-licensed with the state. So they're pretty regulated. So I'm a proponent of using licensed professionals.
Fantastic. And on that note, how can people get in contact with you, Tom?
Well, thanks for asking. So that's the thing. My name is Tom Basey, and the brokerage is Basey Insurance. So really, they can search me and find me. So we do have both at a personal level and at a company level. We have presence on the major social medias, be it LinkedIn, Facebook. You can Google me. So I can be found really by that. I'm not trying to hide. So Basey-Insurance.com is the actual website, but by seeking Basey Insurance, I tend to come up. So I'm available. And further, since you said that, so I'm appointed approximately in the southern band only of the nation, but I'm willing to at least offer. I have trusted partners, so I can put someone in contact with someone else if you're in a state that I'm not licensed in. But I do the other things I would offer. It really is an education. So that's the thing. I can tell someone, I can explain something at a high level, what's available, what carriers like there, and then I'll refer them to somebody that I'm not licensed in that state. But I am available. I would love for them to look for me. And I like to chat. It's evident, right? We're having this discussion. So we'll just shoot the breeze a little bit, and then I'll point you in the direction of somebody that can help you if I can't help you.
Oh, fantastic. We will include all of those things in the show notes. And that QR code that you have on the screen, where does that go?
That goes to Basey-Insurance.com. So if someone's watching in the video, they can just hit that thing. It'll take them right there.
Okay, fantastic. Well, Tom, it's been a pleasure having you on the podcast today. Really eye-opening in a positive way to see the strides that insurance companies have made over the years to really infuse wellness and to motivate people to take care of their health.
Well, thanks to you for giving me this platform to talk, and I'm grateful to the folks that tuned in today to listen. Thanks so much, Michelle, for hosting.
Hey everyone, Michelle Seidling here at Food Experience Unplugged. Are you enjoying the Food Experience Unplugged podcast and are ready to ramp it up a level? Then it's time to go premium. With a premium podcast membership, in addition to all the great podcast episodes you know and love, you'll receive additional bonus content and exclusive interviews from many of our podcast guests. You'll receive a live Q&A access each month where I'll address questions pertaining to holistic health and how you can start your journey. You'll also receive weekly shorter video clips with information on tips, tricks, and strategies to get started, to build consistent habits, and to take charge of your health. Go premium today. I'll see you there.